Thank you so much for coming. I graduated from nursing school in 2008 and had nothing like this. I had no NRSNG to help me, and it's just really great to see you guys here and have you guys come from all over the place to be here. So today we're going to talk about 5 things you never knew about the NCLEX, but you certainly will now. And I'm hoping that you guys can just take away like 1 or 2 things that you can maybe take with you into when you take your exam and you sit down in that testing center and the computer boots up for you. So yeah, hopefully there's just, maybe not all 5 things are going to resonate with you, but maybe just 1 or 2 that you can take with you. So I wanted to start by saying that nursing is a very interesting career path because as far as education goes, it is one of the most rigorous programs that you can do. You have clinicals, you have lectures, you have really difficult exams, and then after all is said and done, when we're going to our pinning ceremony or our graduation, if you walk, whatever your graduation ceremony looks like, you should be happy. But instead, you're thinking about the NCLEX, and you look like this. Not okay, right? Like how many disciplines are there where you graduate, but then you have to do something else really big before you can actually practice? So it's hard. So let's jump in. We're going to start with a quote by Abraham Lincoln. So he says, "Give me 6 hours to chop down a tree, and I will spend the first 4 sharpening the axe." And I really like this quote because to me it gives you a really good picture of your nursing journey where let's say that the tree is the NCLEX and it's this big obstacle that's looming before you, but you have spent the majority of your time sharpening your axe in nursing school. So whatever program it is, whether it's a state-approved program or accredited program, these programs are designed to be difficult for a reason. They're developing you as a new nurse so that you can go in and take that NCLEX. So you are sharpening your axe, and then when you finally get to the NCLEX, the actual act of taking that NCLEX is not that difficult. All right, number 1 of 5, the purpose of the NCLEX. So I went to the National Council of State Board of Nursing website to figure out what they thought about the NCLEX since they administer it, and it freaks us all out. Their purpose for giving the NCLEX is to determine whether or not a nursing student is an entry-level nurse. And they have 3 items that are related to that. Number 1, they recognize that the entry-level nurse will have limited confidence. I'm really thankful to see that word limited in there. No one expects you when you graduate from nursing school to be this perfectly confident person walking into every hospital room and knowing what to do. So limited confidence. The next thing is critical thinking. So I became a nurse as a second career. Before that, I had majored in Spanish and business and was working as a project manager. And I thought nursing school would be a piece of cake, but I had no concept of critical thinking. It just wasn't something that was developed in any other thing I'd studied. So critical thinking is a big part of it. And then finally, clinical judgment with the need for additional skill acquisition. Again, I think this is really encouraging to see that they don't expect you to know everything, but that you will be acquiring more skills as you go along. But yeah, clinical judgment, which comes often from clinicals. So yeah. So you may be asking yourself, am I an entry-level nurse, or will I be? So I have 5 things that I think if you meet these criteria that you can say that you're an entry-level nurse. Number 1, you graduated from a nursing program. So I know a lot of you aren't there quite yet, but you will get there. And that is one of the things that you need to do before you take your NCLEX. Number 2, you took tests and usually passed. I say usually because there are some really difficult exams in nursing school, and they're all designed to be exercising that test-taking muscle so that when you sit down and take your test, you're ready for it. So yeah, you don't have to pass every single test in nursing school to feel confident that you can pass the NCLEX. Number 3, you were engaged during clinicals. This was a huge growth thing for me because before becoming a student nurse, the only thing I did in hospitals was get lost. I literally could not tell what floor I was on or where I was going. I'd take one turn and I'd be totally turned around. So being engaged during clinicals is doing your prep work beforehand. If you get a student assignment, that you are looking up the labs and maybe reading the provider's notes before your clinical actually starts. It's really important. And I will tell you, sometimes some of the questions I got on the NCLEX as like a last ditch effort, if I really didn't know the answer, I'd be like, what did that nurse do that one day in clinicals? So it's just really important to be engaged during clinicals. Number 4, you worked to comprehend when you didn't get it. This is another thing that is really important to do in nursing school. So I remember my first lecture on metabolic acidosis and respiratory acidosis and that whole bicarb thing. And I remember walking out of that going, I have no idea what's going on here. So just found a buddy and we talked through it. And often I would also go to my professor. I had a favorite professor that I actually named my first daughter after. And I would ask her questions too. She's very approachable and just really sweet and encouraging. So you work to comprehend when you didn't get it. And finally, nobody can tell me they're an entry-level nurse if they're not addicted to caffeine. So there you go. All right. The second thing, the NCLEX is your opponent, so you need to know your opponent. You need to know what you're up against. We're going to talk about computerized adaptive testing, types of questions you will encounter on the NCLEX, and then Bloom's taxonomy. Has anyone heard of computerized adaptive testing? Okay, great. I love that we're going to go through this then. All right. So the NCLEX tests you in a certain way. There's this computer program called computerized adaptive testing. And what it does is it estimates your ability to figure out if you're that entry-level nurse. So when you go into the testing center and you sit down with your pencil and your water and your little pad of paper, you log in, and when it feeds you the first question, let's say you answer that first question wrong. That question goes away and the program feeds you the second question based on your answer to the first question. So if you got it wrong, it's going to give you a question that's slightly easier. That next question will be a 50% chance of you getting it right. Does that make sense? So it shouldn't be too hard or too easy. Then, as you go along and you continue to answer these questions, the computer will become more precise in its estimate of your ability until it gets to the point where the computer has a 95% confidence that you are or are not at that entry level. So whether or not that takes 75 questions for the NCLEX RN or 85 questions for the NCLEX PN, so that's the minimum, or up to like 265. It will take as long as it needs to know whether or not you're above or below that number. All right, types of questions you will find on the NCLEX. The most common question is a multiple choice question. So that's the one where the boxes that you check are circles and you can really only check on one. And if you click on another one, the first one disappears. That's multiple choice, one correct answer. Most common question you'll find on the NCLEX. Number 2, a multiple response question or select all that apply. That's the second most common type of question on the test. And that's the square boxes where you can check anywhere from 1 to 5 right answers. You should know that it is possible to have a multiple response question and only one answer is correct. So anywhere from 1 to all 5 could be correct. That's just something to note, because that does confuse some people. They think if it's multiple response, there should be at least 2, but no, you can only have one right answer. Number 3, third most common type of question is fill in the blank. So these are usually calculations, and they're often pharmacology related. Number 4 is the hotspot questions. And so a hotspot question is one where maybe you have a diagram of a heart, and you have to click on where is the tricuspid valve or the SA node. So you just have to know the anatomy and be able to click on it. So that's hotspot. And then finally, and very much not common, are the others, which is exhibit, item, ordered response, audio, and graphic. I don't really have examples of those, but we can, if anybody wants to talk to me later about these, we can. Okay, Bloom's taxonomy. A few people have heard of this, right? Okay. So we're going to talk about this, and we're going to go through an example of what Bloom's taxonomy is. It is a way to measure, somebody named Bloom made this up, I don't know. It wasn't Orlando, I know that. But it's a way to figure out your cognitive level of thinking, like how developed are you in your understanding of a concept. So it starts out at the remember cognitive level. So an example of this would be a normal blood glucose is 70 to 115, okay? So that's just remember, like I could tell my 5-year-old that and she could just regurgitate the information back. Like a normal blood glucose is 70 to 115. That's just remember, like straight up, no idea what that means, but you just remember a number. The second level is the understand, which is the second one there. And that is where you grasp the meaning of the information. So it would go like this. The patient's glucose is 55. This is too low, and something should be done to raise the glucose level. That's the understand level of cognitive thinking. Next, we go to apply. And what you're doing there is you are taking information and then doing something about it. And it would look like this. The patient's glucose level is 55, and the patient is sweating, shaking, and becoming confused. You give the patient juice and peanut butter and crackers. So you think with your clinical judgment that I need to give a quick-acting carb like juice and then follow it with some peanut butter and crackers to sustain that level a bit longer. So that's apply. And then the highest level on the NCLEX that they test for is the analyze cognitive level. At the analyze level, it would look something like this. The patient's glucose is 55, and the patient is symptomatic. Their visiting family member is also hyperventilating and says he is going to pass out. I could hand the client juice since he's still conscious and responding, or I could run to the med room, remove a syringe of D50 and IV push it. The nurse concludes the best option is to give juice. So you just took a scenario with a patient and all these different things. Some of the information is worth something, and some you can just ignore, like the family member. And then you make a judgment call and you do it. That's the analyze, and that is where your brain really needs to live when you study for the NCLEX, because many of the questions are going to look like that, the analyze. Above that, we have evaluate and create, but those are not tested for at this point on the NCLEX, so we're not going to go through those. All right, analysis level questions. There's 2 ways to test at the analysis cognitive level. And the first one is called evaluating client data, where you are pulling a bunch of information like we did with the glucose scenario. And then the other type is prioritizing which action to do first or which client to see first. So on your handout, does everyone have one now? Yeah? All right, raise your hand if you do not have a handout. Okay, everybody has one, good. So looking on that first page, it says breaking down analysis level questions. And we're going to go through this question. I'm going to read it out loud and read the answers, and then I will take volunteers to give me what answer they think is right and why. So the nurse is caring for a client on a telemetry unit. It is 8 a.m. The client has orders for digoxin 0.125 milligrams by mouth daily and furosemide 20 milligrams by mouth BID. The nurse notes atrial fibrillation at a rate of 110 on the client's rhythm strip. Which of the following actions would be most appropriate for the nurse to take? Number 1, withhold the digoxin and notify the primary healthcare provider that the client has an irregular heart rhythm. Number 2, withhold the digoxin and recheck the heart rate and rhythm in 1 hour. Number 3, administer the digoxin and notify the primary healthcare provider that the client has an irregular heart rhythm. Or number 4, administer the dig and document the heart rate and rhythm. Does anyone want to try and guess, or maybe they know for sure what the answer is? Go ahead. Number 3, administer the digoxin and notify the PCP. Okay, why?
Because we want to bring your heart rate down.
Okay. Okay. I like the way you think. You're close. It is not number 3, but you're very close. Anybody else? Go ahead.
I think it's 4 because you want to raise your heart rate.
Okay. Any other reasons that it's number 4? Okay, yep. Yep. Okay, so you were both correct in that you want to bring the heart rate down and you're going to administer the digoxin. So there's a lot of things going on here. We are looking for information in the question, and we're also looking for information that is absent from the question. So it gets a little rough sometimes. But as we can see, they're on the telemetry unit, so we know that something is probably going on cardiac-wise. And then you kind of have to know your medications, your pharmacology, so digoxin and furosemide. Furosemide, also known as Lasix, is a diuretic, so it gets rid of water, right, in the body. And then digoxin is given for 2 main reasons. The first one is to manage heart failure and to help the body pump, the heart pump faster, or not faster, but like more, with more contractility. But the other reason is to manage chronic AFib. So you kind of have to have an idea of what digoxin is given for, and if you know that, oh, it's given for AFib and the patient has AFib, then you actually don't need to call the doctor. So you would just administer the digoxin and document the heart rate and rhythm. And the thing that's absent from the question is the fact that the patient isn't symptomatic. So if the patient was symptomatic, that's a different story, and in that case, number 3 would be correct. Does that make sense? Okay, yeah. It's a lot of information in one question. So we had to know the implications for AFib, we had to know appropriate medical treatment and actions and even interactions of multiple medications. Sometimes they list a bunch of pharmacology and you have to kind of know, like, do these go together? All right, let's flip your page over to the back and look at the prioritization question. So I'll read it again, and then you guys can take a turn telling me which answer is right. So prioritization. The nurse has been assigned to a group of clients. Which of the following clients should the nurse assess first? Number 1, a 25-year-old who had knee replacement surgery 4 hours ago and is complaining of moderate surgical site discomfort. Number 2, a 19-year-old with septicemia whose first dose of IV antibiotics is infusing and who reports throat tightness. Number 3, a 38-year-old with anemia who has a unit of PRBCs infusing and reports feeling tired. Or number 4, a 69-year-old with COPD and a pulse ox reading of 92%. All right, you guys are right. Dang it, I thought it was going to be harder than that. And why is it B? You got it. Yes, that's awesome. Good job, guys. All right, so you guys just interpreted multiple data on 4 different clients and you determined the most life-threatening need. And somebody taught you about the ABCs, or the CABs, or whatever we call it these days. All right, so that's critical thinking. Those 2 questions are critical thinking. It's the analysis of facts to form a judgment, and very few career choices have this magnitude of critical thinking with lives hanging in the balance. So this is a very special career path that you guys have chosen, and it's going to be exciting. All right, now that you learned about computerized adaptive testing, I want to get all of that out of your mind so that you don't freak out when you're taking the NCLEX. There's something they're actually called pre-test questions or random samples, and these are placed, so I know you all are going to pay a lot of money to take the NCLEX. You're going to do a lot of studying, and not only are you paying money to them, but they are then going to turn around and do some testing on you during your test. So they're going to take 15 questions in the NCLEX RN and 25 questions actually in the NCLEX PN, and they're going to randomly place them throughout your test. So they are taking these pre-test questions that they've created to see whether, like, see how students answer them for future NCLEX, like future NCLEX. So don't panic. What I mean by this is, since you know with computerized adaptive testing that if you get one wrong, the next one's going to be easier, I feel like this helps a lot because if you get a question that's easy, you can just tell yourself this is a random sample question, answer it and move on. Like just forget about it. Because you don't want to sit there and be analyzing like why. What's going on?
At the end of the test, or are they going to, if they're randomly throughout?
They are randomly throughout at
Say
this
it's a
point.
sample?
No. You won't know. It's invisible to the person taking the test whether or not this is a real question or a sample question. Good question. Any other questions? Not yet. Okay. All right. One more thing I want to cover is that the day before your test matters. So preparing for the test, do not cram the day before the NCLEX. Trust what you know. You may want to review one or two things. You can take a quick practice test or maybe do a SimCLEX test on NRS and G. Relax, do some physical activity, create an enjoyable distraction. And you got to plan your route to the test center. Definitely give yourself plenty of time to get there. Then you want to fuel your body at dinner the night before. Eat a nutritious meal. Try not to drink alcohol if you can avoid it, because I just feel like when you do that, you don't get a good night's sleep necessarily. And then finally, give yourself 8 hours to sleep, but do not count on it. So obviously, it's a big deal to take the NCLEX. You might be nervous and you might toss and turn the night before. But I will tell you that I have been a nurse for 10 years, and every time I work a 12-hour shift, I don't sleep well the night before. I toss and turn, but when I wake up, I just wake up when my alarm goes off, and I know that I can do anything for 12 hours. So definitely don't count on getting a good night's sleep, but know that that's okay. You can get through it anyway. So, because sometimes you know you're tossing and turning, and then you're looking at your clock and you're freaking out even more. So don't do that. All right. So go out there and be your best selves today, and happy nursing.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.